Good morning. My name is Christina Forbes. As you're getting to know, I'm the wife of seriously injured worker Lauren Forbes. So I thought what I'd do, since it's been some time, is I'd go on to Dr. Gershman Part 3. But before I moved on to Dr. Gershman Part 3, I actually needed to just kind of educate myself on a few things. Because injured workers, when dealing with workers' compensation or WorkSafeBC, right across Canada, you almost need to become a doctor when dealing with them, in dealing with some of the terms and analogies and words that they use throughout their reports, which to some can get very confusing, and to me, wow, so what I did was I read Dr. Gershman's report and I pulled out words that I really didn't know the meaning of medically, I guess. So a few of those words that I didn't know was idiopathic, which is any disease or pain arising from an internal dysfunction of an unknown cause, or a condition in which there is a disturbance of normal functioning. I didn't know that. Somatoform or somatoform disorder. See, you even got to learn how to speak Latin. Represents a group of disorders characterized by physical symptoms suggesting a medical disorder. However, somatoform disorders represent a psychiatric condition. Major depressive disorder, characterized by a combination of symptoms that interfere with a person's ability to work, sleep, eat, study, and enjoy once pleasurable activities. Very disabling, prevents a person from functioning normally. I didn't know that. Pathopsychology. Didn't know that word either. Is the study of the disturbance of normal medical, physical, or biochemical functions either caused by disease or resulting from a disease or abnormal syndrome or a condition that may not qualify to be called a disease. Wow. Physiology is the study of normal, healthy bodily function. When something disrupts normal function, psychological processes, it enters the realm of pathopsychology. Didn't know that either. What was the other one? Iatrogenics. I didn't know what that word was. Apparently it's an opiate addiction, or the side effects of Percocets and morphines and things like that, like the addictive part of it. Didn't know that. So I looked up iatrogenic, so I'm not too sure. I guess that's what that whole little word means. Induced in a patient by a physician's ability or activity, such as prescribed pain medication. The word originally meant a condition induced by the physician's examination, manner, or discussion, but the term is now applied to many adverse conditions resulting from the treatment by the physician or surgeon, especially in an infection or other complicated treatment. Suboptimal. I just thought I'd check that. I kind of figured it meant, maybe not quite clearly enough to see. So that's being below an optimum level or standard level. Injured workers, when they go and see men like Dr. Gershman and psychologists and so on, have to do this little 20-question kind of questionnaire while you're sitting in the waiting room, and it's called the DRAM, and it's like a psychological and risk assessment kind of test. It consists of 20 questions. I'm sure many injured workers across Canada have done this. Dr. Gershman uses 20-minute exam or 20-word exam, as I guess it pertains to some of the stuff he discussed in the thing. So I checked out what DRAM meant, and it's a simple patient classification to diagnose or to identify and diagnose distress and evaluate risk. Along with the DRAM questionnaire comes this thing called the MSPQ, and that's the Modified Somatic Perception Quiz. It's designed to measure heightened somatic awareness among patients with chronic pain, although this quiz has been known not to it doesn't work to, finalize the function and so on and so forth, and was only weakly associated with pain outcomes. Thus, the MSPQ appears to be reliable, but the somatic perception it measures may have little relation to actual patient outcomes. So I didn't know that. And I kind of learned how the score, the meter score, it was quite interesting to learn. So asymmetry, I kind of figured that had to do with balance, but I wasn't too sure. So asymmetry or asymmetry, disproportions between two parts that are normally alike. Edemia is the accumulation of excessive amount of watery fluid, such as sweat or whatever, and swelling. Volatile, so it means to be with deliberate intention. Snuff box. Now, I didn't realize that there was actually a part of the human anatomy called the snuff box, but yes, there is. Anatomically, that's the hollow scene of the radial aspect of the thumb side of the dorsum, which is the back of the wrist, when the thumb is extended fully. So that's kind of, that would be this part right here when you extend your thumb. Palpation is the method of examination in which the examiner feels size, shape, and firmness or location of something, body parts, where the examiner is the health professional. Psychosometrically, or psychosomatics, is the science of psychological measurement. Psychometricians, or metricians, is design and administer psychological tests, both to generate empirical data on mental process and to refine their understanding of the measurements. So, so didn't know what that word meant. Allodynia, I wasn't too sure what that meant either, but I thought I'd clarify that. So that's pain that results from a non-injurious stimulus to the skin. Okay, didn't know that. Which is really funny because when I get to Dr. Gershman's report here, I had read earlier in, I think it was part 2 of Dr. Gershman's report, the impression and plan that Dr. Gershman kind of thought for Lauren. So it says, Mr. Forbes is approximately 9 months post-injury. He presents with the following. 1, post-right radial neck fracture, open reduction, internal fixation, ongoing right elbow pain, slight flexation, supination, and pronation limitation. 2, right scaphoid fracture with ongoing wrist pain. 3, post-left commutadistal radius fracture with ongoing pain in that area. 4, bilateral global arm pain to fingertip pain, including back and neck pain reported. 5, I would call all of the above idiopathic pain. Okay, so look at that. Okay, sorry to do. I would call, where did I see it there? Oh, up here. I would call all of the above idiopathic pain. So if I go back and I look at what I read on idiopathic pain, it is any disease arising from internal dysfunction of an unknown origin, a condition in which there is disturbance of normal functioning. I would believe that all of the above is idiopathic pain. So pain of an unknown origin is pretty much what he's saying. You know, the screw and the fractures of the elbow and the K-wire fixation that he had, or flexation or whatever that he had in the wrist. I guess, you know, from a doctor's standpoint, Dr. Gershman didn't really see why he'd have any pain in that area. I don't know why you're having that pain. I looked into the Latin and Greek meaning of idiopathic, and you can go and actually look this up on any dictionary online. Do you know what it means actually in Greek and Latin? I don't know. Idiopathic in Greek and Latin transfers to simply, I don't know. It's I don't know pain. I don't know why you're having that pain, Mr. Forbes. I don't know. So, you know, there's many other words and things that Dr. Gershman made in this report, and every injured workers report is just filled with this kind of nonsense that injured workers and lawyers and representatives have to shuffle through and make headway through and educate them on while trying to, you know, in an injured workers case, while trying to rehabilitate. So not only are they concentrating on money problems, wife, children, bills, so on and so forth, work, their injury, the list goes on and on and on. They need to learn Greek, Latin, and how to become a doctor pretty much. Everything from, you know, medication prescription onward. It's ridiculous. I do have a part 4 to Dr. Gershman where we're going to get in and kind of pick apart his report, and there's a couple sentences in here that don't really make sense that I could definitely use some clarification on. So thank you very much. Stay tuned for the next video. Have a good day.